Today we're going to go through the process of taking an alginate impression. I'd like to point out some of the materials and equipment that's going to be needed to take the alginate impression. First, we need alginate powder. That powder is going to be mixed with water, and we're going to mix that in a special bowl using a specific spatula for mixing alginate. In order to put the alginate into the patient's mouth, we have to put it inside a tray, and that tray has to be lined with wax to retain the impression material as we take it. And also, we will use an adhesive product inside the tray to actually also help to retain the impression material as we're taking the impression in the patient's mouth. Once we have taken a maxillary and mandibular impression, we'll finish up with a wax bite. Let's begin by trying the tray into the patient's mouth. The tray has to fit, and it has to cover all of the teeth and all of the surrounding structures and tissues. The first thing we're going to do is try the trays in the patient's mouth. We will be taking the mandibular impression first. Please note how the tray is inserted into the mouth. It is brought in from the side, rotated over the teeth, and then seated onto the teeth. We need to make sure that the tray covers all of the teeth, tissues, and surrounding structures. Now we'll try in the maxillary tray. Again, the tray is inserted from the side and rotated over the maxillary teeth. It is then seated over the teeth, and we want to make sure that the tray gets all of the teeth, tissues, and structures. Once we know that the trays fit, we are now ready to prepare the trays. And the first thing we will do is to apply beading wax to the periphery of the tray. The wax will help retain the impression material in the tray. Once the periphery of the tray is beaded, we now are going to apply tray adhesive onto the bottom of the tray. Note we are only using a very small amount of the adhesive onto the tray. Once we have both the maxillary and mandibular tray with beading wax and the tray adhesive, we are now ready to get the alginate powder prepared. The first thing that we need to do is to fluff the alginate powder. That means we are going to tumble the canister, mixing all of the powder ingredients together. And we're going to wait a few seconds before we take the lid off. Now we can measure using the powder scoop. And in this case, we're going to measure 2 scoops of powder. The ratio is 1 to 1. So 2 scoops of powder to 2 increments of water. The powder is always added to the water, never the water to the powder. As the powder is added to the water, you're going to slowly stir to get all of the powder particles moistened. Once you have done that, you're going to have to use a very vigorous stropping motion of the spatula against the sides of the bowl. to produce a creamy, smooth consistency to produce the alginate impression. To load the impression material into the tray, you start from the side of the tray and run your spatula along the side of the tray, distributing the alginate material into the tray. We're going to take some alginate in our finger, and that alginate is then going to get placed on the occlusal and incisal surfaces of the teeth before we insert the impression material. Now you're going to insert the impression material. Remember, you're coming in from the side, rotating it over the teeth, and seating the impression tray and material from posterior to anterior. You need to instruct the patient to lift their tongue up to the roof of their mouth and move their tongue side to side. Try to make sure that the lip is also out over the impression tray. Depending on the type of set, normal or fast, the material is going to set up and then the impression can be removed from the mouth. To remove the tray, you're going to use a lifting and side-to-side motion to loosen the tray and remove it from the mouth. You're then going to give the patient some paper towels so that they can wipe their mouth. You need to inspect the impression that you've just taken to make sure all of the teeth are reproduced, as well as the tissues and oral structures. Once we have taken the mandibular impression, we're now ready to take the maxillary impression. Remember that the ratio of powder to water is 1:1. Once we have measured out the powder, we're then going to pour the water into the bowl, and we're going to sprinkle the powder into the water. Remember, always powder into water. Get all the powder particles moistened. Do a vigorous mix against the sides of the bowl, stropping against the sides of the bowl with the spatula, producing a nice, smooth, mix, homogeneous, creamy consistency. Load the tray by pushing the spatula against the tray and pushing the material forward. Take some alginate on your finger, put some on the palatal area, and rub the alginate impression material over the incisal and occlusal surfaces. Insert the tray from the side and rotate it up over the teeth, seat it from posterior to anterior. We're taking the maxillary impression last because the maxillary impression could produce a gag reflex. Keep this in mind. If your patient starts to raise their hand and reacts to the impression, ask the patient to put their head forward and to breathe through their nose. The impression will set up fairly quickly, and then it can be removed from the patient's mouth. Please realize that until the impression material gels, it is not possible to remove it from the patient's mouth. Once the material has gelled, we will be able to lift it from the patient's mouth by again using a downward and side-to-side motion to break the seal and rotate it out of the patient's mouth. Now we're going to inspect the impression, making sure that we've reproduced all of the teeth, tissues, and surrounding structures. The last thing we're going to do in the alginate impression procedure is to take a bite registration. That is done with the bite wafer that you see, and the patient is going to be instructed to lightly bite. Again, insert it into the mouth from the side, rotate it over the teeth, and have the patient lightly close together. This is going to show their bite in occlusion. And now we have our finished product. This is a negative reproduction of the mandibular arch and surrounding tissue, and this is a negative reproduction of the maxillary arch and surrounding tissues. We are now going to take the impressions and pour them up in a plaster gypsum product. The plaster gypsum product produces the study model. The bite registration will be included in the study model, and this would be your final product.